Okay, thank you. Hi, everyone. Thank you so much for joining. Tonight's event is hosted by J-Teen together with Keshet. For those of you that don't know, J-Teen is an anonymous and confidential support line for Jewish teens in the UK and Belgium, aged 11 to 20. Invite you to look at our website to read more about it. And we're really excited tonight to have Dr. Marcy Forta with us. Marcy is the founder of Atzmi, an organization in America that she set up to support the mental health of Jewish girls with programs specifically designed to improve body image and to reduce eating disorders. So we're really excited to have you with us, Marcy. And there will be the opportunity to ask questions at the end. You can put your questions into the Q&A box at the bottom, and only the panelists can see them. Tonight's panelists are myself, Michal Buki from J-Teen, and Judy Parnas of Keshet and J-Teen in Belgium. And just to say, we're not ignoring any questions. We're probably going to make time at the end for Marcy to answer them all, because hopefully some of your questions will get answered along the way. And I'll pass you on to Judy.
Hi, everyone. Thank you, Michal. On behalf of Geshet Counselling Service and the J-Teen Antwerp volunteers, we welcome all the participants. We thank you for joining us. Our special thanks to Dr. Marcy Forta, whose vision, drive, and generosity have brought us here together to teach us while reminding us how similar our struggles may be. And of course, to Michal of J-Teen UK, who are always available to support Antwerp youth in sensitive and creative ways and are so good at sharing resources for the better good. So we present Dr. Marcy Forta.
Thank you so much. And I just really wanted to thank you both, because Michal and Judy have been inspirational to me. I've learned so much from them, and their tireless dedication to the community, the organizations that they run, and the things that they do are just so inspiring. So thank you for inviting me here, and thank you for all the things that you do.
Thank you.
Marcy, okay, we'll let you get on with it.
Okay, I'm going to share my screen. So let's just make sure that this is working. Can everyone see the screen? Okay, I'm going to get going, and then please feel free to ask any questions. Like I said, it's so important. I want to get to them all, but sometimes we answer them throughout. All right, so I know, of course, that our hearts and our minds are with Acheinu Beis Yisrael, so we hope, Ezras Hashem, to hear Besuras Tovas Bakarov. All right, we talked a little bit about what I do. I work in eating disorder awareness, education, and prevention, and I am the founder and director of Atzmi, which is an organization that we created to support the mental health of frum girls via what we call the My Best Self Project curriculum. This helps to increase their self-compassion, self-esteem, emotion regulation, body acceptance, and reduce the focus on outward appearance, among some of the other topics that we cover. We also know that the current situation in Eretz Yisrael, there will be additional stresses, both on us and on our children. And everyone experiences stresses and challenges very differently. So these types of programs that help our children and ourselves kind of deal with emotion regulation and give us some tools are very important, more than ever. A lot of times people ask me why I got into this space, what it was that precipitated me to create these types of programs. And so I like to tell a little bit about my story, that I used to run a women and girls clothing store here in Michigan in the United States, where I'm from. It really affected me watching young girls struggling in their changing bodies as they became young women, and young women became mothers, and young mothers changing bodies, and even women getting older. Everyone struggled, and truly it affected me very profoundly. Particularly because it was something that I had grappled with intimately as a teen. I had struggled with my own eating disorder. So it really stayed with me when I sold the store. And that is kind of, I felt like Hashem was speaking to me that this was something that I needed to do. All right, so as you can see, we have a lot to cover this evening. So I'm just gonna go right into it. But we're gonna talk first a little bit about statistics. Let's start with some of the statistics. I generally start this way because I want you to understand just how significant the problem that we are facing is. The truth is that over 75% of adolescent girls don't like their bodies. And body image is self-image. So it's very difficult to separate how you feel about your body from how you feel about yourself. 81% of 10-year-olds are afraid of being fat. 80% of 13-year-olds have attempted to lose weight. Between 35 and 57% of adolescent girls will engage in some form of either crash dieting, fasting, self-induced vomiting, the use of diet pills, excessive exercise, or the use of laxatives. 35% of 5-year-olds are already restraining their food intake in order to lose weight. I had a lady call me from, actually, she's from Manchester, but anyway, I get calls from all over the world. She happened to call me about her 5-year-old granddaughter who she had over. She was having a sleepover with her and she was giving her a bath and she was in the tub. And her granddaughter said to her, "Bubby, look at me. I'm so beautiful because I'm skinny." And she said to me, "Why is my 5-year-old granddaughter saying such a thing? We don't have any secular media in our home. We don't have newspapers. We don't have magazines. We don't have, they have nothing. They don't even have smartphones." So she wanted to understand where that came from. And the reality is that girls as young as 3 are already perceiving thin to be something good and fat to be something bad. And our community is not immune. We also know that 42% of first grade girls want to be thinner. I have a colleague who used to be a first grade teacher, and she kind of moved into the eating disorder prevention world when this happened. Her first graders were all throwing out their lunch at lunchtime, she noticed. And so she went up to them and she said, "What's going on, girls? Why are you throwing out your lunch?" And they said to her, "Because we want to be skinny." So basically, first graders, which, okay, here in America, I probably should give you ages. First grade is about 5 or 6. We're throwing out their lunches because they wanted to be skinny. So they made a pact at such a young age. So it's a little bit scary. And the sad reality is that there have been increases of between 80 and 100% in eating disorder incidents reported since the onset of COVID in different places all over the world. Truly, practitioners are sounding the alarm that the growth rate of eating disorders are higher than they've ever been before. And so even though we're technically no longer in a pandemic, we know that the mental health implications have created a very difficult and uncertain situation overall. But honestly, this is especially for adolescents and teens. There have been alarming increases with growing numbers of inpatients, outpatients, referrals, and even emergency admissions of eating disorders since 2020. Between 9 and 12% of people, and this is the United States, so that's about 29.8 million Americans, but it's also about 70 million people worldwide, and the statistics are very similar for throughout the world, will be affected by or diagnosed with an eating disorder in their lifetime. Now, this is only a diagnosable disorder. This actually does not indicate how many of us are struggling with food and eating and body image in general. And we know that 95% of those who have eating disorders or are first diagnosed with them are between the ages of 12 and 25. In the last decade alone, the number of preteens being treated for anorexia has doubled. And sadly, eating disorders have the second highest mortality rate among mental illness in adolescents, second only to drug overdoses, and the second leading cause of mental health disability for girls and young women. About 26% of people who are affected by an eating disorder will attempt suicide at some point throughout their eating disorder journey, which translate to them being 11 times more likely than the general population to attempt so. About 10,200 deaths each year can be attributed directly to an eating disorder. And females are twice as likely to develop an eating disorder over a male, even though males do have eating disorders, and we do struggle with that in our community as well, just not in the same numbers as we do for females. Sadly, there are 5-year-olds that are in hospitals in an inpatient facility with an eating disorder diagnosis. And yes, women as old as 80 have been diagnosed. We have seen much anecdotal evidence that women who are in hospice, so that end-of-life care, when they're offered a decadent or fattening dessert, they'll refuse it because they'll say they shouldn't simply have the fat or calories of it, which kind of shows us how deep-seated some of our body image and appearance ideal issues are. And it's really devastating to see how deep-rooted these have become. Sadly, most doctors and healthcare professionals will admit that their education on body image is scarce at best, and how body image affects our child's mental health, because it really does. And their overall view of themselves is not something they truly feel comfortable to discuss or educate parents on. And also what they know about eating disorders is limited as well. I can tell you stories, maybe later if you want to hear more about them, but I can tell you a lot of stories about people who were misdiagnosed or not diagnosed early on because they simply didn't get the signs and symptoms of them. So what about the From community? What about our community specifically? These were very general statistics. What are some of ours? Well, we know that we are a very insular community, and we don't like to have a lot of empirical study of us overall. But there are several studies, and there's much anecdotal evidence and study that have found that Jewish females are twice as likely to develop an eating disorder than the rest of the world. That is above the 9 to 12% that we just mentioned a moment ago. So if we put that into context, the regular world will have between 9 and 12% of people affected. If we are up to twice as likely, that means between 18 and 24% of us could be diagnosed with an eating disorder at some point during our lifetime. And all these numbers that I'm giving you are a lot of the studies done from before the pandemic. So these numbers likely have increased significantly. And sadly, that said, I am getting calls almost daily about girls in our schools struggling. Some places of epidemic proportions. We know that eating disorders can be very contagious. So it's it's a significant issue in our communities. And although we work to be as insulated and isolated as possible, we know that Western culture has truly impacted our communities. I am a great believer that we have significantly improved our mental health acceptance and treatment overall in our communities. It's something we should be immensely proud of, but we still sadly do have some stigma from it. And this can be a real impediment to the early detection of and the successful treatment for mental health illness. For whatever reason, and I can give you those reasons later, I don't think they're as important right now, but there is more stigma in the From community around eating disorders than other mental health illnesses. So much so, in fact, I have a colleague who's a therapist. She is treating a husband whose wife has a very significant eating disorder. She's really struggling, and it has impacted her fertility and her ability to have children. He tells people that his wife has cancer because he's too ashamed to admit that the reason she is struggling is because of her eating disorder. And there are many stories like that, sadly. 60% of Orthodox Jewish mental health professionals, so From professionals, believe our community is underserved, and 85% of them believe it's due to stigma. So I think we've really established that body image struggles and eating disorders are real issues in our community, and that they are significant issues in our community. So we're going to get to a lot of ways that we can help our daughters, but first I'd like to talk about what body image is and how it's created so that we can have a better understanding of how we can help create more positive outcomes for our daughters. Because we know that women and girls who possess a more positive body image are more likely to have better physical and mental health, whereas girls and women with more negative thoughts and feelings around their bodies and about their bodies are really more likely, sadly, to develop certain mental health conditions, including not only eating disorders, but really anxiety, depression, low self-esteem, any kind of distress. So what is body image? Let's start there. Body image is not actually what your body looks like. Rather, it is what you think your body looks like. So it's all your feelings and beliefs and emotions or perceptions about your own appearance. It's how you feel about your body and in your body. Now, it's important for us to understand that body image is a very completely subjective construct, and it isn't necessarily realistic or true, right? It's something that goes on inside your own mind about your own body. And when you look at somebody else, you can't see their body image by looking at them. If I look at you, I won't be able to see what your body image is, and you cannot see mine by looking at me. So we talked about the fact that when we have a more negative body image, we might become very hyper-focused on what we look like. We constantly tend to compare ourselves to others. We might hold ourselves to unrealistic or unhealthy ideals. If, however, we are able to create what I like to call a more neutral body image, because a lot of people like to say positive body image, but we're not going to feel positive in and around our bodies all the time. And that's okay. That's just something that we have to accept, and that's fine. But when we can create that more neutral body image, what we're realizing is that our bodies and our appearance are not the only determinants of our self-worth, They're not even the most important thing about us, the most interesting thing about us, and they make up such a small part of who we are. So when we cultivate that more neutral body image, then we have better self-esteem, self-acceptance, self-compassion, and really a lot less impact from whatever images we see, you know, in the magazines, even the from magazines, see in the stores, hear from loved ones, whatever pressures we have, we are not as affected. So body image issues are one of the strongest risk factors for the development of an eating disorder, but they are also a risk for unhealthy lifestyle behaviors and unhealthy weight control measures. So throughout the presentation, I will be referring to unhealthy lifestyle behaviors or weight control measures. And when I say that, I'm referring to things such as the use of laxatives to control your weight, diet pills, excessive exercise, things such as fasting, self-induced vomiting, skipping meals. Some people will use syrup of ipecac syrup, or they'll give themselves enemas. These are all unhealthy weight control measures. How is our body image created then? Where does it come from? So it has a lot of parts. We're just gonna high level go through some of these parts so that we have a better understanding of where our body image comes from. The first is what we call the appearance ideal. The appearance ideal means whatever society tells us is the ideal way to look at a certain point in time. So of course, when there is an ideal, right, or a perfect that we're trying to achieve, we're going to continue to strive to get there in some way, shape, or form. But when we do that, this can sometimes compel us to resort to those extreme and dangerous measures to conform to this ideal, like those unhealthy weight control measures we just mentioned a moment ago, in order to help us achieve this ideal. So oftentimes, the appearance ideal encourages women and girls to desire an appearance or a thinness that is neither realistic, healthy, or really truly in their best interest. Now, we have to remember the appearance ideal is not a health ideal, right? When we talk about a health ideal, we're talking about how we nourish our bodies, care for them, and treat them with respect and care, right? These beautiful vehicles that Hashem gave us for our neshama. It's about overall wellness and health that is both mental and physical, not one or the other, but both together. And I like to point out that appearance ideal changes over time. It's just a completely arbitrary measure made up by influential people. And right, it has nothing to do with our health, nothing to do with our wellness. And honestly, it has no benefit to any person physically or psychologically. So I just kind of put this up there. I'm not going to go through it with you, just the idea of how our appearance ideal changes over time in history. And even in different cultures today, people have different definitions of what beauty and appearance ideals are. But what we want to teach our children and learn ourselves is that our inner beauty has nothing to do with what you look like. It has to do with how you feel and see yourself. And no one can take that from you if you don't let them take that from you. Okay. The second part of how our body image is created is through something called diet culture. And when we refer to diet culture, this doesn't just mean being on a diet, because you don't have to follow any sort of official diet to be caught up in the culture of dieting. But when we talk about diet culture, it's that pervasive belief that appearance and body shape are really they're more important than your physical, psychological, or general well-being. Now, I really, first of all, like to say that the discussion of diet culture could be an entire presentation in and of itself. So this is a very high-level concept, but it can be very difficult to spot diet culture because we all have grown up with the same messages. So it's kind of, I like to compare it to living in a goldfish bowl, because truly we're all swimming in the same water, right? We're hearing the same messages. And sometimes it can be very hard for us to point that out and recognize it. We really have so many beliefs and values that we have learned from it. And it's hard to question sometimes these things and think about things in new ways. So just a couple beliefs of what diet culture teaches us is that appearance and body shape are the most important things that we should work to achieve. It also values thinness and attractiveness over our physical health and emotional well-being. It subscribes to a very rigid and specific set of expectations for how people's bodies should look. And it's the idea that controlling your body, particularly via what you eat, so via your diet, by limiting it, is something that is praiseworthy, is the norm, and is something that is expected of you. Okay, so it kind of condones unhealthy behaviors in the pursuit of being thin. The next part of how our body image is created is via something called weight stigma. And weight stigma is any discriminatory act towards somebody because of their weight or their size or their shape. Now, there are many studies actually on the long-term negative outcomes that are associated with weight stigma. It's important that we understand that for children, especially and teens who experience weight stigma in their formative years, we see some of these negative outcomes, things such as emotional distress, depression, anxiety, low self-esteem, social isolation, even suicidal thoughts, which leads to that increased mortality, poor body image. Ultimately, actually, weight stigma leads to long-term weight gain as well. So there are many, and you see that it leads to eating disorders, and it even undermines preventative health care because people are afraid to go to the doctor. So it has many negative health outcomes. And unfortunately, we find weight stigma everywhere, in every setting, as you can see. What can happen is that weight stigma can often lead to bullying, which could be physical or emotional. It can lead to teasing somebody. It can also lead to blame, that someone might feel blame for any illness or weight problem that they might have, which could be due to many other things. And we're going to talk about where weight comes from, but weight does not only come from how much we eat and how much we exercise. There are many parts to weight, such as genes, stress, what life stage you're in, illnesses, you might have medications that you take, etc. But we'll go through that a little more later. It also leads to guilt and shame around your body and food, that reluctance to get help when needed, and even a reluctance to work on preventative care. The attached picture is from Magazine, which promotes diet culture. The idea of family on a diet. They had also a column called Girl on a Diet. And we're going to talk about why putting a young child on a diet is never, ever a good idea, and how that can affect them mentally very significantly. Again, media is is another part of body image. And of course, that's very different. Our community has a different level of usage, but unfortunately, we're not completely immune. I believe our levels of usage are way lower than the secular world, but unfortunately, there is some influence, and it can influence how we diet, how we feel about our food, social appearance anxiety. This could be from fashion magazines. It could be from our mannequins that we have in the store. It could be from sharing pictures with one another, whatever society dictates as attractive and desirable, like we talked about. Another part of our body image is something called family, obviously, which is a very complicated and influential risk factor category. So when I talk about family, I am talking about mothers and fathers. I'm also talking about siblings, grandparents, aunts, uncles, cousins, whoever has an influence on the child's life. And now we know there are a lot of dynamics that go on between mothers and daughters, how a mother models her own food behavior, right? How fathers speak to their children about their appearance, how siblings speak to one another. I could spend a lot of time here telling you stories of grandparents who wanted their grandchildren to lose weight, and so they offered to either pay them per pound. If every pound that they lost, they were going to give them a pound, or they were going to take them on a shopping trip, or they were going to take them out, to do something special, a special trip with them. There are a lot of mothers who, won't let their daughters eat what the rest of the family is having because they feel that their child needs to be on a restrictive diet for their weight, or mothers who won't buy their children certain clothing sizes when they gain weight. There was a girl who came back from seminary and she had gained a lot of weight. Her mother said to her, in our family, we're a size 2. And I think our sizes are a little bit different than yours. So that's probably really small in your sizes, but it's pretty small here too. But she said that when she gets back to the regular family size, then she'll take her shopping. And I really believe that the mom was trying to help her daughter, but she doesn't realize the harm that this is actually causing. Now we know that the dynamics between parents and children is especially influential until about the age of 11, right? So everything that the mom or dad or family models is very crucial until 11. And then after about that age, then of course, there's also a peer influence as well. So we can always change our behaviors. There's always room for improvement, but we have to be especially careful with our young children. And we're going to talk about things that we can do, of course, like we talked about. And these are just some studies which show how influential moms are, with their daughters. The idea is that, we all want what's best for our children, but we've grown up with that same culture, learning the same struggles, and this is what we know. And we just don't want our children to suffer any stigma or bullying or ridicule over their body or over their weight. But what we don't realize sometimes is that is exactly what we are doing, and we ourselves are causing the harm. So, okay, let's go to the next one, which is pressures. This is also a part of how our body image is created. And in our communities, there are some unique pressures that our girls and we face. And there are many, each of these, in other words, could be an entire conversation, but we're just going to high level because I really like to have a lot of time for how we help our daughters. So of course, there's a lot of academic pressures, going to the right schools, the right seminaries, getting good grades, perfectionistic pressure, that need for us to kind of be perfect, do it all, do it well. We're very familiar with shidduch pressure, having gone to the right school, having the right size and shape body, being attractive, etc. We have a lot of thin pressure in our communities as well. It's something that is very highly valued in our society. And then we have something called the superwoman ideal, which is a lot of times when I speak to the girls, and I spend a lot of time with the girls as well, they see their moms doing everything, right? They say their moms come back from the hospital, they just had a baby, they're still cooking and cleaning and making the lunches and helping the kids with their homework. They have their own careers sometimes, they're having company. And the girls feel that their moms are perfect. They're not always privy to the struggles that go on behind the scenes. It's really important for them to have some idea of what we're going through. And we're going to talk about that later. Obviously, it has to be based on their maturity and age level, but they have to see that we're not perfect, because that creates the inability for them to ask for help, which is another pressure. That asking for help is something negative sometimes in our community. And of course, sometimes because we have larger families, Baruch Hashem, sometimes we give a lot of responsibility to some of our children, and some of them can handle it, but some of them might not be able to. Attached, as you see, is a magazine from a Frum magazine, just showing this year she's in seminary, next year in Israel, concerned she's growing in more ways than one. Just that pressure to be thin. I know food is one that is always a topic that everyone's been waiting for. It's a very complicated subject. We know that we are a religion that is surrounded by food and eating. And if you think about it, this can be difficult for even the least body obsessed individual, but somebody who's struggling with their body image or an eating disorder, Shabbos, Yom Tov, Simchas, parties in school, all these things create stress, confusion, and risk for them. So it's really very difficult for them. We have some confusing messages with food, and we're going to talk more about food later on, but how much food is too much food? We want our girls to know how to cook, but not to eat too much. They should bake, but not partake of it. How do we use food in our family? Is food a reward? Is it taken away sometimes as a punishment, or do we use it as a tool for our health and growth? So sometimes when we take food off the table to warn your child to not overeat, or we hide food, this can actually lead to our children feeling guilty to eat until they are full, or they're scared to eat food. They feel like, oh, I ate too much. Even if my tummy tells me that I'm still hungry, my mom's saying that I ate too much. So they don't really get that feeling of fullness. And again, we'll talk a little bit about this more. And of course, the concept of control. Oftentimes, our young girls don't really have a lot of control in what they are able to eat. And this is probably younger girls. Older girls do have a little bit of control. And so this can be a difficulty for them. When I talk about mixed message perception as how body image is created, I'm talking about how some of the messages that we give to our girls are given one way, but maybe perceived another. How our girls internalize the message or perceive them, right? That's really what's going to be relevant and significant. Oftentimes, we talk about the concept of our internal connection to Hashem, our neshamas, and the value of them. But sometimes we still place that stress on externals and physicalities, right? We still want them to look good, get thin, get to the right schools, marry well, dress in the latest fashion. So sometimes that creates a mixed message for them, which can be very difficult. So we really do make a lot of fuss over somebody who loses weight, which makes it a primary motivator for a child over other things. shidduch messages can be very confusing because we tell them it's about your midos, it's about how you live your life, your davening, your learning, but yet we want them to be thin. And so these can be very confusing messages for our daughters. The concept of tznius. So again, some of these concepts are a little deeper, but the idea here is that when the girls only hear the external message of tznius, right, where the lines are of what you can and can't wear, and they don't hear the beautiful hashkafa that is primary to the message of tznius, then their risk is actually increased for an eating disorder or body image issues. And then sometimes it's hard for us to talk about our body's physical development. We don't always talk enough about our physical bodies, how they grow and how they develop, what is normal, what is expected. There was I work a lot with different dietitians, and one of them shared a story with me about a girl who grew up in a very sheltered home, and she did not have any idea of what was going to be happening to her body during puberty. When she started to change and grow hair, she thought she was becoming a man. When she started to menstruate, she thought she was dying. She actually ended up having a nervous breakdown and was hospitalized for several months because of this. And that's one extreme. But the idea is that we have to help our children understand that what happens to our bodies is actually a bracha from Hashem for us to have children. And we have to do it in the tznius proper way. So what I want everyone to remember is that our physical appearance is not always in our control, right? There is a lot that is genetically predetermined in how we look. And there are other things about our bodies that change with time. Hormones, puberty, our stress levels, how much sleep we get, our family habits, our age, even medications and medical conditions. These all are how our bodies look, part of how our bodies appear. Of course, our bodies are gifts from Hashem, and they help us carry through our lives. It's our job to take care of them with great respect and value. The idea is to find that balance between caring about your appearance, and letting that run the show or control or dictate the story of who you are and what you stand for. So we talked about the fact that when you have a real significant negative body image, this can be a risk factor for an eating disorder. And before we get into our recommendations, it's just, I'd like to have you understand what I am referring to when I speak about an eating disorder, because sometimes people think they can just see somebody with an eating disorder, it looks like someone who's emaciated, but that's actually not the case. Only 6% of people who are diagnosed with an eating disorder are actually considered underweight. So the vast majority of people with an eating disorder are normal weight or in a larger body. So eating disorders are severe mental illnesses that have a very complex onset, which can be different for every person. They can be chronic and debilitating, and they can be difficult to successfully treat. In fact, over 95% of the time when someone has an eating disorder, it is accompanied by another mental disorder, things such as OCD, could be depression, anxiety, post-traumatic stress disorder, bipolar, panic disorder, all kinds of things. And I think it's really, really important that we understand that food in an eating disorder is not the cause of the eating disorder. Food is actually the vehicle to express an eating disorder. So it's the way that the sufferer gives voice to these complicated emotions that they're experiencing. This is how they kind of take back their control and express these complicated emotions. So I'd like to just give you an understanding of the types of eating disorders that are out there. I am basing them on the DSM-5, which is the standard classification of mental disorders used by mental health professionals in the United States. I'm not certain what is used outside of the United States, so I apologize, but I imagine they're the same. The first one is anorexia nervosa, which is one that I'm sure most of you are familiar with, where someone persistently restricts the amount of food. They really have a true fear of gaining weight. Oftentimes people with anorexia nervosa will present with a low body weight, so something that is not normal for their age or their gender or their physical health or their development, but that's not always the case. You actually can't determine if someone struggles with anorexia based on their appearance alone. And then we have something called bulimia nervosa. Now, bulimia is recurrent episodes of binge eating. When I talk about a binge, this is an intake of an excessively large amount of food during which the person feels a true sense of a lack of control over what they're eating. It's not, people will say to me, yeah, I know what that is when I have a really large Shabbos meal or something like that. It's not like that at all. During this time, they really feel it's almost in a trance that they're eating. They can't stop themselves. They don't even know how much they're eating. And then they follow these binges with compensatory behaviors. So they compensate with either some of those unhealthy weight control measures that we talked about earlier, that extreme exercise, self-induced vomiting. They might use laxatives, whatever. They might take all kinds of things to get rid of what they've ingested. Excuse me. The next one is something called binge eating disorder. Now, this differs from bulimia in that we have the binges in this disorder, but there is no use of inappropriate behavior to compensate for the binge. So it's kind of like the binge without the compensation. And then we have something called ARFID, avoidant restrictive food intake disorder. Sometimes people will characterize this as a feeding disorder more than an eating disorder. And we sometimes find it called extreme picky eating. It does impact children mostly, but there are adults with ARFID. People with ARFID have a genuine lack of interest in eating and food. Most of the time, not only do they get full quickly, but they have sensory avoidance. So they might not like the taste or the texture or the smell of a certain food, right? Or the temperature even. They fear aversive consequences to their eating. So either they're going to get nauseous or vomit or choke or get sick. They have a real fear of this. So sometimes ARFID can be induced when a child, I know of a girl who was babysitting, and her sibling who she was babysitting for choked pretty severely on something he was eating. And Baruch Hashem, he was fine, but after that, this young girl actually developed ARFID because it was such a trauma for her. And then the last eating disorder is something called ASFED, which stands for other specified feeding or eating disorder. These people have extremely disturbed eating habits, a very distorted body image, and an intense fear of gaining weight. Some examples will include something called atypical anorexia, which is someone who is actually not considered underweight, but they have all the other characteristics of anorexia, and they've lost a significant percentage of their body weight, but they are not yet underweight. Something called purging disorder, which are those compensatory behaviors that we mentioned in bulimia, like the vomiting and laxative use or extreme exercise, but no binge beforehand. And the final one is something called orthorexia nervosa. Orthorexia nervosa are really very obsessive behaviors around healthy foods. So this person might strictly avoid foods that they believe to be impure or unhealthful, maybe, for instance, only eating organic or never eating food with preservatives or anything that's been manufactured, or removing all things from their diet that they deem unhealthy. But it's really about their health. And so even though the outcome is that they might lose a significant amount of weight, it's not about their body image as much as it's about their fear of becoming unhealthy. ASFED is actually the most common type of eating disorder, followed by binge eating disorder, and then bulimia, and then anorexia. So most people think that anorexia is the most common eating disorder. It's actually not. Adolescence happens to be a time of increased risk for eating disorders because it is a time of such tremendous growth and change, right? Adolescents are developing their own thought and belief system. They're fostering their own independence. They are working to create and solidify their own personal relationship with Hashem. There are just so many physical and emotional changes that go on during adolescence. They go through many physical changes. So their brains are actually maturing as well. And they have an increased need during adolescence for energy and nutrients. So that's calories and types of food. So like we talked about before, any period of time where a child is on a diet or goes through a period of time with reduced nutrient intake during this adolescence phase, this leads to measurable cognitive or mental, like, impairment in their brain. Truly, they become almost malnourished very, very quickly. An adolescent, it doesn't take much at all for them to become malnourished. So we have to be so careful. We also know that it's difficult for them to understand and reflect on their own emotions. They're extremely impulsive, right? Because they want to maintain that feeling of control for their decisions and choices. And their social identity is being formed. Social identity just means their sense of who they are based on the shared goals they have with their community. So it's a very big time of transition. There's a lot of stress and anxiety usually that accompanies adolescence. So it's a big period of risk. We know that prevention is key. Prevention works. Clearly it's needed from everything that we've discussed, but we have to focus the programs on the right messages. We have to have programs that are for our community that are meaningful, appropriate, cognizant of our sensitivities and culture. And of course, we have to implement these programs during adolescence and focus them on the right messages. So as parents, we have a big job to do. What can you do today to help your daughter create the mindset and the skills that she may need to help offset an eating disorder or other feelings of body shame or body image issues? Number one is change the conversation. What we look like is not as important as who we are. It's not as important as our relationship with Hashem is. It's not as important as what we do or how we live our life. Sometimes we always teach our children, of course, that what's on the inside matters, but sometimes we model something different and we inadvertently reinforce the message of what we look like on the outside is most important. If you take a moment to think about what it is you compliment people most on, especially little girls, what is it you say? Have you lost weight? I love your sheitel. Your outfit's beautiful. You look pretty. Especially for little girls, you love your hair bow. You look so cute. You're so beautiful. Not that you can never compliment somebody on their physical appearance. I'm not saying that, but I do think it's time to change the focus to talk about their midos, their talents, their qualities, their accomplishment, their smile. They look happy. That color lights up their eyes. There are different ways than focusing primarily on their appearance or their body shape. And of course, like we talked about, our bodies are gifts from Hashem. They are what carry our neshamas in this life. It is Hashem gave them to us, and it is our job to treat them with care and how we treat them. So, and what our bodies look like is not reflective of who we are, nor is it, a truly showing of what our capabilities, abilities, midos, talents are. We want to talk about food as fuel with our children. Food is nourishment. Food sustains us. Food is something that we need. Hashem created it that we need food several times a day, each and every day. I have a colleague, her name is Yafi Lavova. She's a very wonderful dietitian. And what she uses this mushal, that you have to be conscious that you're growing a flower and that you are the soil, that which supports, nourishes, promotes the growth and development of your child. So adequate nutrition is fundamental to the healthy development of your child and the maximization of their potential. It's not just the quality of the food that you give them, it's also the quantity. So it's really important that we don't become a bully in an effort to help our child. Number two is do not use food as a reward or a punishment. It should not be used as a reward in school, not for losing weight, not for going to camp, not for anything. When you use food in the wrong way, right, then you undermine healthy eating habits because you potentially disrupt the child's ability to really accurately recognize and respect hunger and fullness signals, right? What happens is we make food about feelings of achievement or an alleviation of a negative emotion. So we're using food as a short-term incentive, but it unfortunately has very long-term effects on our child's relationship with it. And we certainly don't want children to become reliant on food to soothe themselves or to regulate their emotions. So we have to be so careful how we talk about it. And of course, you are the parent, it's your job to kind of moderate that situation. But at the same time, we don't want to make food about morality. So we don't want to call food good or bad. And a person who eats certain foods is not good or bad, because then there's judgment surrounding food, right? The conversation around food needs to be about moderation and balance. It's more than the ingredients. We know that food is more than the ingredients on your plate, right? Food is about so many more experiences. It's blended into our moments of simcha, of Shabbos, of Yom Tov, family ritual, all Yom Tovim. So food has value outside of just the caloric content of it. You have family foods, you have recipes passed down from grandmothers. So we want food to be an enjoyable experience that we learn to intuitively eat and know our hunger and fullness signals. The idea should be more about healthy habits versus dieting to change what your body looks like. Okay. If we have our own food issues, this is really important for us to get help. Our children respond to are modeling, and they pick up cues that are not verbal. So if you're struggling with your own food, weight, and body image issues, your daughter will pick up on this. So it's so important for you to also get the help that you need. It's very important to create an intentional mindset. Wilma Rudolph was the first American woman to win 3 gold medals. And she said, my doctor told me I would never walk again after an accident or something that happened to her. She said, my doctor told me I would never walk again. My mother told me that I would. I believed my mother. That's how powerful we are as mothers to our children. As a mother, you are one of the singular most powerful resources your child has in this world, especially your daughter. Your influence is profound. So whether we do this consciously or not, we are impacting our daughter's sense of their self, their values, everything they choose to prioritize in their life. Our influence as mothers really starts before our child is born, and it goes long after you're no longer in this world. So it's really important for you to get help. It's also critical that we stop judging people on their weight or shape or appearance or body size. We know, we've talked about this, I'm not going to go into it again, but weight bias can cause measurable, irreparable harm. And it has been associated with adolescent depression, substance use, suicidality, disordered eating, and of course, eating disorders. We've all been guilty of this at one time or another, but we have to make a conscious effort to stop talking about people's weight and change. And I think it's so wonderful for us to teach our daughters that our bodies will go through so many journeys in life, right? Puberty, pregnancy, aging, menopause, physical illness, emotional and social stresses. We want them to understand that every journey that our body takes toll on who we are. And so we shouldn't be judgmental on ourselves or on anyone else for their body or shape. The studies show that when you or even a doctor tells your child that they need to change their weight, your child hears that something is wrong with them. They do not hear what you mean to say. That's not what they hear. So we have to be really careful. If your doctor needs to have this conversation, I'm not saying it's a conversation that doesn't ever need to be had, but if you're concerned that the doctor will have this conversation with you, then maybe call your doctor's office before you take your child in and tell the doctor or nurse that you're of course willing to have this conversation, but you do not want to do it in front of your child. So please don't do it while they're in the room with you. We think that a child will take it better from the doctor, but the reality shows that all a child hears is that I'm ugly, I'm obese, I'm unworthy. Our conversations with our child have to be more about healthy habits. We have to change our entire family habits if we want one child to change theirs. It's not just about that one child. We want to make exercise more about joyful movement versus calorie burning or restriction, right? We know that exercise has so many valuable outcomes. Improved mood, it reduces stress, it helps you sleep better. We pay better attention in school. Exercise helps with emotion regulation. People who engage in some form of regular exercise tend to live healthier lives. Their immune systems are better. They have improved body image. There's just many reasons why we should exercise besides weight control. And then, of course, our bodies change dramatically throughout adolescence. We need to understand that our bodies develop certain things during adolescence that we will rely upon throughout our entire life. And they will have implications for our future if we don't take care of them properly. Things such as bone mass, which is generally achieved by late adolescence, or our cognitive skills like we talked about. And then, of course, most children gain about 50% of their adult body weight during adolescence. And for the vast majority of children, their height is determined by the end of adolescence. So it's all normal for them to be growing and developing. We want our children to value themselves based on their unique talents, abilities, midos, capabilities, traits. So really be careful how you speak to your daughter. Remind her that emotions and hormonal changes are normal and expected. But even though they're normal and expected, sometimes they can make it difficult for us. And you welcome her sharing her thoughts, frustrations, concerns. Help her differentiate between things that are in her control and what is not, because this can really help her with her thoughts and feelings. Sometimes girls think that certain things that are not in their control are things that they can change. But if they can let go of those things, it really helps them deal with other things in a much more positive way. Creating that loving environment, giving our child a chance to make their own choices and some of their own risks. This has to be done, of course, within reasonable limits for a child's age. But I'd just like to tell a quick story of a mother who called me about her 11-year-old daughter who had asthma. And the mother was managing this girl's asthma through her diet, and she wasn't requiring medication. Well, the school that the daughter was going to called the mother one day and said, your daughter is stealing food from people's lunches. And when she called me, she was mortified. She felt terrible. And we talked to her daughter, and her daughter was very upset that there were certain things that she had no control over whether or not she was allowed to eat them. So the mom was amazing. And they together made a plan of the certain things that the daughter really wanted to add back to her diet. So she had some control, and this behavior stopped. And even though the mom knew that it might mean that the daughter might need some medication, she realized that she had to give her back some control over her own choices. When we talk about loving unconditionally, the idea is, of course, that you love them no matter what, but this doesn't mean that rules, structure, and discipline are not expected. These are still parts of your home, but I love you very much, and I do this for you. And I really like to remind people that you can take back your control around your thoughts and emotions. Rabbi Pliskin, this is a wonderful quote. If you do, chas v'shalom, suspect an issue with your child, you notice any worrisome or concerning behavior, it is your job to be proactive. Early detection and intervention is much more successful in the treatment of eating disorders. So trust your instincts. Don't blame yourself. I don't see any constructive point to blame. As you see, eating disorders and these types of issues are very complex, and they are never just affected by one thing. Referrals, get the school social worker as well as your child's doctor to get some recommendations for you. You can also reach out to organizations such as J-Team and Keshet to help you find the right person. Ask questions. Mothers, you are your child's best advocate. And then, of course, seek support for yourself, because these can be very stressful journeys. I like to put this out there because it's so important for us to sometimes get stuck in what we've done in the past. And this defeats us moving forward. So ruminating about the past will get you nowhere. Go ahead and learn from the past, whatever you can, and then put it behind you. It doesn't serve us. It doesn't serve our child. So let's just create new pathways going forward. Okay, thank you very much. This was kind of a high level idea of what what goes on in body image and feeling of physical self. And I'd love to answer any questions that you might have at this time.
Thank you so much, Marcy. I have to say, it was not my first time listening to you, and each time hearing it again, get to hear more interesting aspects. So thank you so much. There was a couple of questions in the question box that came in. Some did get answered along the way.
Okay.
I don't know if we wanted to go into any of them a bit more in depth. We've got a few minutes still. So there was one specific question that came in, I guess. How can somebody take their kids even into consideration when they themselves, I guess as a mother writing in, was bullied as a child about her weight, all the things you kind of spoke about, being paid to lose weight, and all the mental images and messages that she was given, and now she's married with children. So how can she begin to start helping her own children?
It's a really good question, and it's really hard. And I think, she's brave for bringing that up. I think everyone has had experiences, some more significant than others, for certain. I think it's important to take baby steps to, use some of these things that we've talked about and try to make changes in your home. I am a very big believer in also trying to get help for yourself, speaking to somebody about your body image issues and the struggles that you've had. Awareness is and education are the first pieces in how we make changes in our life. Just recognizing that this is something that you struggled with is huge, actually. And each time you talk to your child or you're about to say something that is connected to weight or shape or body size, I would take a minute, take a breath, and think to yourself, okay, is this something that I should be saying? Is this something that is going to be a positive have a positive outcome on my child, because once we say it, we can't take it back. So the first thing is always to get help for yourself, and really to kind of go through. Obviously, there's a limited amount of time that we have in a presentation, and I'm always also very happy to talk to people and answer questions via email or phone. But we need to take the time for ourselves and kind of learn how to make these changes, and that will also change what happens in your own home.
Thanks so much, Marcy.
Sure.
I think Judy wanted to come in.
Yeah, I think this came up also when we were discussing some questions that might come up. So we all struggle with those daughters who open their cupboard on Shabbos morning and tell us that they don't know what to wear and they look awful in their clothes.
Mm-hmm.
And you've spoken about changing the conversation in general and guiding, learning a new way to talk to our children, which is something that we all have to do. And I'm sure that, through your speech, like Michal said, we've heard it before, but there's always so much that we can pick up on and we can learn from. But in the moment when your child is really stuck and struggling with the way they look now, do you have any guidelines about how to respond to that?
It's very tough. You're 100% right. The first thing I always like to tell people is I think that sometimes when a child says, I look ugly, I look fat, I don't like how I look, it's not actually about their physical appearance. Something else is going on with that child. It could be tied to their physical appearance too, but usually there's an underlying anxiety, depression. Sometimes they're masking other underlying feelings or emotions that are going on in conjunction with it. So sometimes taking the time to sit your daughter down and really understand, where is this coming from? Because fat is a universal word for just feeling yucky about yourself when a girl says that, or I feel that I look ugly. So number one, I would say to really try to understand where it's coming from, and encourage her to dig deeper about those emotions. What are the emotions that you're thinking about? Because I think sometimes people feel mistakenly, and this is part of diet culture, that if I look a certain way, my life will be better. People will like me more. I'll be more successful. I'll do better in school. I'll do better in my job. My life will be better. So it's really important for us to explain to them, first of all, that our bodies, the way our bodies look and are shaped, come from many different places. It's not always in our control. Hashem created us with different talents, with different abilities, capabilities, skills, and he created us to look differently. All of us look differently. The one thing I would say is really important is never, if your child asks you specifically if they're fat, don't say yes or no. Whether they're fat or not absolutely makes no difference. Don't make it about the physical appearance. Try to make it about them, their feelings about themselves. Because here's the thing, if your child's thin and you say, you're not fat, it's absolutely a no. What if they do gain weight one day? Then you've reinforced the message that thinness is valuable, right? And you shouldn't worry about it. So that's not the message that we want to give them. We can talk to them about the fact that sometimes we live in a society where we feel like we have to look a certain way, but that's not how Hashem created us. You're created just as you're supposed to look. We have to kind of talk to them in different ways. And this takes time. I do have an entire video on my WhatsApp channel as well, what to do if your daughter or your child asks if they're fat, because it is a larger conversation, but these are just some high level things. But try to take it off their physical appearance, because we have to show their value outside their physical appearance.
Okay, thank you.
Mm-hmm.
Thanks, Marcy. But there's another question. It's quite a common question. I'm seeing it coming in a few different ways, but it's all pretty similar from parents. We've spoken a lot about what not to do and how to make sure that we're not encouraging unhealthy habits. But what happens for parents who are struggling with children that are overweight, and how do they safely support them without, causing them to have an eating disorder? Quite a couple of parents have asked this. Their children are significantly overweight and they're struggling to lose weight.
So the first thing I would say is you have to understand, if a child is really significantly overweight or they're using food in a way that is unhealthy, first two things to do are, number one, have them evaluated physically, make sure that there isn't some hormonal or physical issue with the child. If that's the issue, then that has to be medically managed, number one. Number two is this becoming an emotional eating type of situation, or an eating disorder on another level. That's something, because sometimes we do use food in an emotional situation. And if that's the case, obviously the child will need some therapy or mental health help for using that food in one way. People with anorexia are using food to control their lives in one way, but someone who's really significantly overeating, not just maybe eating a little more than you think is needed, that's a different level. So those things have to be dealt with first. If you're talking about a child who is moderately what you feel is over their growth curve, there's a few things also to remember. Number one, is this child still on the growth trajectory that they've been on from the beginning of time? They might have been always at the 80th percentile, and they're still staying in the 80th. They're growing healthily for their body. Their body has always been larger. That could be their genetic makeup. And so you might not be able to change their body, but you certainly, as a family, can change to healthier habits if you're concerned that what they're eating or what they're doing isn't in their best interest. So, so that's number one. Like I said, I wouldn't single the child out in any way. I would make changes in the family. If you're concerned that this one child is eating too much or eating foods that you deem not nourishing, too many non-nourishing foods at times when they shouldn't be eating those foods, rather than hiding the foods or, closing the kitchen or not buying them, which will really cause them to go to their friend's house or use their money from their allowance, or they'll trade for their other lunch food in school, whatever it is, they will find a way, trust me, to have that food. Rather, make changes for the whole family so that child doesn't feel singled out. Do physical activities that the whole family are going to do. Change some habits at home. I think, it doesn't mean that that child can never have dessert, and it doesn't mean that that child should never be allowed to eat. I think the whole family has to make those choices. Again, make sure that you have to rule out any physical or emotional issue. And really it is a larger conversation, but there are intuitive eating models. Ellen Satter has what is called the eating competency model, and how to feed your child to kind of help them develop a more intuitive approach to eating. What we want to develop is a relationship with food where we eat when we're hungry and we stop when we're full. As a parent, it's our job to help our child create that mindset, right? They're not going to learn that by themselves. Just like we teach a child how to have hygiene, brush your teeth, take a shower, we teach them these things. We want to teach them to recognize the cues that Hashem created in our body. If you think about an infant when they're nursing or they're drinking a bottle, whatever it is, they're not going to eat past full. You cannot get a baby to finish what they don't want. So sometimes we've kind of created, finish what's on your plate, don't eat that, you ate enough, you can't have a second helping. If we follow this more eating competency model, we're going to create a more intuitive relationship with food, and without using it as a reward and without using it as a punishment, these things will kind of fall into place.
Thank you, Marcy. I'm just thinking of something, imagining that some of these mothers who are hearing this for the first time, and how overwhelming it must feel for us as mothers to change the way things have been modeled to us, and the way we, without thinking, have been talking to our children.
Yeah.
So we know it is possible to make change. And do you have any resources or books or something that could support some mothers in thinking in this new way, and with this new awareness, and supporting their children?
I have to remember what the book is called. There's a really good book called, I think, Raising Emotionally Healthy Daughters. I'm going to get the exact author and book for you to post out. It's a fabulous book. I actually myself am writing a book specifically for the frum community with a lot more of these things in it. It's not out yet, but I hope that within the next several months that we should have it out there, because I do think that our community is very different, and that we have different considerations that maybe some of the other books won't have. But this particular book, and I am blanking on it, of course, at the moment, but I will give it to you to stick out to everybody, is a really fabulous book. Most of what's in there is appropriate and healthy and helpful. But yeah, it is a whole new mindset and a whole new way of thinking. But we've seen that as our levels of obesity are rising, even with all the shaming and the guilt and the weight bias that we've created in trying to guilt people to lose weight, all that's happening is we're creating more unhealthy people who are gaining more weight than they have in the past. So we really do need to change the way we communicate this issue, because it's not working. Unfortunately, it's really not working, and it creates a lot of mental health anguish for our children. But it is a whole new mindset. So it does take time. It definitely takes time.
Thank you.
Okay, thank you so much. I think we'll leave it there because I think most of the other questions you answered along the way.
Okay.
And thank you all so much for joining tonight. It's really been great having you on. And thanks everybody for coming. Have a great night.
Thank
Thank
you.
you.
Bye-bye.